Bismillahirrahmanirrahim. In this video, we will discuss the remaining point of the public health sciences. Okay, so in the एमरजेंसी रूम में क्या होता है कि सिर्फ पेशेंट अलाउ होते हैं, ठीक है, ER रूम में, और फैमिली को कहा जाता है कि आपने स्टे आउट करना है. 40 डायबिटिक हैज़ अ प्रॉब्लम इन अ बेड विद अ वाल्व. ओके, नेक्स्ट स्टेप टू टेक इज आस्क द पेशेंट व्हाट काइंड ऑफ द बेड प्रॉब्लम दे आर हैविंग. ओके, सो ऑल पेशेंट इन अ कार्डियोलॉजी क्लिनिक complains about the receptionist behavior. So the staff and the other patients are happy with the receptionist. What will you do? Apologize and offer that I will talk to the reception. Best example of the psychologist stress is a Best example is a financial crisis. The best strategy for the female wanting to lose weight is the self-monitoring. Okay, so doctor is a good if he is a respect the patient decision regarding the treatment. ठीक है, a normal and a healthy individual is he who eats, sleep and exercise regularly and lead a disciplined life. Okay, so patient has an intractable long history of the pain as taking various painkiller. How do you treat the patient? Psychologically, cognitive treatment. On the serology of the patient is HIV positive. What will be the next step? Confirm by performing the other test. Serology में positive आया, लेकिन आप confirm करोगे ना by performing the other test. What step for the prevention must be taken in the ICU is a frequent hand cleaning. कौन से प्रिवेंशन आपने बार बार हैंड को क्लीन करना है, ठीक है. पेशेंट इज पोस्ट ऑफ इन द ICU, ही नीड्स अ मैकेनिकल वेंटिलेटर फॉर द रेस्पिरेटरी सपोर्ट. द पेशेंट इज एंशियस अबाउट इट. हाउ विल गो फर्दर प्रोवाइडिंग दिस मैकेनिकल वेंटिलेटर टू द पेशेंट. एक्सप्लेन द नीड एंड इंपॉर्टेंस ऑफ वेंटिलेटर टू द पेशेंट. हाउ टू असेस द compliance to the patient therapy. Patient perception of the severity of the disease and effect after not using the drug. When a person is talking to the patient, listening to the tone and speech of the patient may have a impact. This is called as a attending and the listening of the patient. Okay, आपने अटेंड करना फिर उसे लिसन करोगे. Definition of the sickness is a sense of the one not feeling well. On the initial patient interview, least likely things to be done is project an image of the authority. You are performing a medical interview with a patient and having some difficulty obtaining the accurate information regarding the events that brought him into the office. Which of the following physician communication tactics leads to the collection of the most accurate information using the open-ended question coaching? Okay. Initial interview least likely thing to project the image of the authority. A 30-year woman in the Azad Kashmir was injured mildly in the earthquake that killed many people apart from her distant uncle. She would most probably is a situational crisis. Okay. नेक्स्ट ये सिचुएशन में आता है ना, फार्मास्यूटिकल कंपनी ऑफर अ ट्रिप ऑफ द फॉरेन कंट्री विद द फैमिली एंड से देयर इज अ डिस्कशन पैनल अबाउट देयर न्यू प्रोडक्ट. बट शुड बी द फिजिशियन टू रिफ्यूज द पोलाइटली. Okay, and which of the following statement best describe the ethical implication of the doctor being offered by the pharmaceutical company to appear on a TV show promoting a drug? It is aligned with the medical ethics as long as the doctor discloses any conflict of the interest. Regarding the doctor and the pharmaceutical company relation, which is the correct, is the poor resources together for the betterment of the poor, not a poor, it's a pool resources together for the betterment of the health institution. Okay, and four basic pillars of the medical ethics is the autonomy, justice, beneficence, non-maleficence. क्या क्या है? autonomy, justice, beneficence और non-maleficence. अब autonomy क्या होता है? Honoring the patient preference, informed consent and the confidentiality. Beneficence acting on the patient best interest even it conflicts with the autonomy. Okay. And the non-maleficence about avoiding the harm. Justice involves a fair distribution of the healthcare resources. A medical ethics क्या होता है? Basically, it's a moral code of the conduct of the doctor. Young female patient with a psychiatric illness recovering with the oral medication. Her aunt, out of the curiosity, calls her the psychiatrist, inquire about her disease, and the doctor denies to give any advice. He is the maintaining which step of is a confidentiality. Confidentiality can be breached if the patient authorizes you. Next is the confidentiality can be breached if the patient authorizes you. ठीक है. It also comes as the most important component of the Hippocratic oath is the confidentiality. Okay. So doctor-patient relationship breach may apply in which of the following scenario? Young woman having the suicidal thought. Only you can breach the confidentiality in which situation? If the woman having the suicidal thought. Female diagnosed with a grade 4 CA ovaries, the patient requests the doctor not inform her family about her condition and the severity. The family has now come in the follow-up to know about her disease. What shall be the next step to be taken? Tell nothing to the family. इसको अगेन देखिए, फीमेल डायग्नोज ये फोर्स, ठीक है। पेशेंट रिक्वेस्ट डॉक्टर नॉट इन्फॉर्म अबाउट हर कंडीशन एंड द सेवेरिटी, फैमिली हैज़ नाउ कम इन द फॉलो अप टू नो अबाउट हर डे, बट shall be the next step, tell nothing to the family. Patient was diagnosed with a pancreatic cancer. Doctor on his way to the hall bumps into the patient brother who requests not to share his news with the patient as he would not tolerate it, which will become his and he informed that they are planning a family discussion in a few days to disclose the news. But shall the doctor to tell his brother that it will be dishonesty with the patient's family and the medical staff working for his ट्रीटमेंट। ओके, इसको दोबारा से देखिए, एक पेशेंट है, उसको डायग्नोज हुआ पैंक्रियाटिक कैंसर से। डॉक्टर ऑन हिज वे टू द हॉल बम्प्स इनटू द पेशेंट ब्रदर हु रिक्वेस्ट नॉट टू शेयर विद द पेशेंट एज ही विल नॉट टॉलरेट विच मिली, जो कि उसका ट्रीटमेंट जो है डिफिकल्ट बना देगा। इन्फॉर्म दे आर प्लानिंग फैमिली डिस्कशन अ फ्यू डेज, बट शेयर विद द डॉक्टर, उसको बताना चाहिए आपको डॉक्टर को, सॉरी ब्रदर को, कि इट विल बी ये पेशेंट के लिए डिसऑनेस्टली फॉर द फैमिली मेडिकल स्टाफ वर्किंग फॉर हिज ट्रीटमेंट। A 9-year-old girl who has a terminal illness asked the physician, "Am I going to the die?" The child's parents previously told the doctor they do not want the child to know their diagnosis and the prognosis. The doctor best response to the child, "Tell me what your parents, आप पूछोगे कि आपके पेरेंट्स ने आपको बेटा आपके बारे में, आपकी बीमारी के बारे में क्या बताया। ओके, 77-year-old male complaining of the abdominal pain reports to the emergency department with his wife. A many mental state examination reveals a pronounced forgetfulness and the disorientation. His physical examination and the investigation suggested a diagnosis of the acute appendicitis requiring the immediate surgery. However, the patient is unable to understand and give the informed consent. What should the doctor do? It's obtain the consent form from his wife to perform the surgery. आप क्या लोगे, consent form जो है उसकी वाइफ से लोगे to perform the surgery. इसको भी दोबारा से देख लें एक बार। एक कॉल मेन है एब्डोमिनल पेन रिपोर्ट्स टू द इमरजेंसी विद हिज वाइफ। मिनी मेंटल स्टेट से फॉरगेटफुल डिसओरिएंटेशन थी, फिजिकल एग्जामिनेशन पे उससे अपेंडिसाइटिस जिसकी वजह से इमीडिएट है, पेशेंट इज अनएबल टू अंडरस्टैंड, तो आप ऑब्वियसली उसकी वाइफ से लोगे ना। During a session of the history taking, a patient told the house officer that he had no plans of disclosing his HIV status on his wife and requested the doctor to keep his information going. Which of the following actions in line with the medical ethic? Persuade the patient to disclose the information to his spouse in the absence of which the doctor should do so. Okay, आपने पेशेंट को बताना है कि तुम्हारे लिए हार्मफुल है, ऐसे कैसे किसी और को भी स्प्रेड हो सकती है, फिर क्या करो, मतलब उसको सारा आपने परसुएट करना है, ठीक है। द बेस्ट क्वालिटी ऑफ द डॉक्टर टू रीच एट द पॉसिबल डायग्नोसिस द गुड लिसनिंग। अगर आप गुड लिसनर हैं तो आप सब कुछ हैं, ठीक है। गुड डॉक्टर एंड द पेशेंट एमसीक्यू, डॉक्टर कैन प्रैक्टिस इफेक्टिव मैनेजमेंट बाय द गुड कम्युनिकेशन। द डॉक्टर पेशेंट व्हाट इज द मोस्ट नंबर इज अ म्यूचुअल ट्रस्ट। इट ऑल्सो कम एज अ डॉक्टर पेशेंट रिलेशनशिप फर्स्ट एंड फॉरमोस्ट इज अ म्यूचुअल ट्रस्ट। ओके, so mutual trust can develop in the doctor-patient relationship when the doctor shows honest behaviors with the truth-telling. Good doctor-patient relationship requires the active listening to every question of the patient. It also comes as the factor that can best improve the communication between the patient and his doctor is the active listening. Regarding the good ethics of the doctor is the active listening. The most common cause of the lack of the communication and understanding between the doctor and the patient is the hurried approach with a casual attitude. ठीक है, आपने जल्दी जल्दी पूछा और इसलिए। द प्रोफेशनलिज्म विद द डॉक्टर कैन बी बेस्ट असेस बाय रिकॉर्डिंग हिज और पंक्चुअलिटी। प्रोफेशनलिज्म में क्या है, कैसे असेस करोगे आप उसको, रिकॉर्ड हिज और पंक्चुअलिटी, कॉन्शियसनेस, इंटेग्रिटी एंड अवेलेबिलिटी टू द पेशेंट। इट ऑल्सो कम विद द डिफरेंट क्वेश्चन व्हाट इज मीन बाय द प्रोफेशनलिज्म ऑफ द इज द पोलाइटनेस एंड गुड बेड साइड मैनर्स। डॉक्टर रिकॉग्नाइज बाय द पोलाइटनेस एंड द गुड बेड साइड मैनर्स।